3 months after the deadly coronavirus came to US shores, and on the same day nearly 1,000 Americans died, President Trump came to the podium and finally admitted this.
I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks.
Having previously dismissed COVID-19 as a political hoax, even he couldn't look at this graph and not acknowledge the gravity.
100 to 200,000 deaths.
President Trump wants people to focus on the black portion of this graph. It shows that as many as 2.2 million Americans would have died had the government done nothing at all, though no one had ever proposed that. Then look down here at the shallower curve, the supposed rosier outcome, where even with the stringent mitigation measures now in place, at a minimum, 100,000 to 240,000 Americans are predicted to die. Donald Trump is now calling the bottom end of that range
a very low number.
And without a drop of irony, last night he appeared flummoxed by those who said COVID was just like a flu.
And think of it as the flu. But it's not the flu. It's vicious.
Seemingly forgetting he was chief among those making the comparison.
And view this the same as the flu. And it is a little bit different, but in some ways it's easier.
Maybe sites like this at Elmhurst Hospital in New York, just up the road from where the president was born and raised, were part of his wake-up call. Elmhurst epitomises the desperate plight of medics in New York. Staff say they're overwhelmed and under-resourced. The ward's so full to capacity that tents outside take the overflow, while makeshift morgues on the street house the dead. This doctor from another New York hospital says they're fearing for their own lives while desperately trying to save others.
The acuity and volume that we're seeing right now feels like we are in a war zone, and it feels like, honestly, a third world country. Considering what we're seeing. There's patients stacked up in the hallways. There's patients who obviously have critically low oxygen levels, who need to be intubated, who need critical care. And we just don't have, obviously, the bodies and resources that's needed amidst this current time.
And all that taking not just a physical, but an emotional toll.
And initially, I was trying to pick up extra shifts, obviously just to help others out. But we're realizing more and more that it's a marathon, not a sprint.
But it was speed that the captain of this US aircraft carrier was begging for to save the lives of more than 4,000 sailors trapped on board after an outbreak of COVID-19 was spreading fast. In a letter, he demanded that they be immediately removed for quarantine, saying, "We are not at war. Sailors do not need to die." The Pentagon says it doesn't want to discuss the numbers of infections, but confirmed on Tuesday that nearly 700 service members had contracted COVID-19, 100 more than the day before. A tiny snapshot of the bigger picture, and a virus spreading with deadly speed across America. Well, they're now making the comparison between 9/11 and the Vietnam War, the two conflicts that are really etched on the American psyche, and they're saying the death toll from COVID-19 will be higher. Just think of the numbers on that graph in my piece there. We're now being told that the death toll will rise from 4,000 in total today to more than 100,000 people in a couple of weeks' time. It's really hard to get your head round the number of people that will have to die on a daily basis between now and then in order to reach that number. And the number, that is a number on the minimum. It could be even higher. They're trying, of course, they're saying at least, to bring the levels of death down, but it's not clear how they're going to do that. They're not talking about putting any further restrictions in place. There was no talk of a national lockdown, for example. On the plus side, though, it does finally appear that Donald Trump gets it, despite the fact that less than a week ago he was still talking about opening up parts of the economy for business by Easter. The big question, of course, though, is how will this play out for him politically in an election year? Much is being made in the last few days of the bump that he's got in the polls. That's true. That has happened. But compare him to George Bush, who before 9/11 had an approval rating of about 51%. That jumped to 88% after. Compare that to Donald Trump, who has gone from 42.6% in the middle of March, just a couple of weeks ago, to 45.9% now. So he is hardly home and dry.
Siobhan, thank you very much. Well, joining me now from New York is Dr. Chidamam Ilabachi, who's Associate Chair of Emergency Medicine at the Long Island Jewish Valley Stream Hospital. Dr. Ilabachi, if I could just ask you to perhaps tilt your camera a little bit. We're sort of seeing the mask, but not the whole of your face at the moment, if you wouldn't mind. That's perfect. Thank you very much for joining us in such a busy time. I just wondered if we could start by asking what you have been experiencing in your emergency room in the last 24 hours or more.
So really in the past 1 month, what we've been seeing are an increase in cases of patients with either confirmed or highly suspected cases of COVID-19. Increasingly, their acuity has been greater, meaning they're a lot sicker, and they are coming in higher and higher numbers, to the point where most of our resources are now being allocated towards treating COVID-19 infected patients rather than the general emergency medicine population that we've been seeing in previous times.
How are you and your colleagues coping? Because we're looking at the horrifying figures coming out of New York, and obviously every one of those figures tells a story of personal tragedy. How are you coping with that?
So this is a really remarkable time. It's relatively unprecedented. There have been pandemics before. For most of us, for most of my colleagues, this is the first one we've dealt with personally. So we're doing our best to cope by finding strength in one another and by finding the resources through our larger parent organization, Northwell Health, which has been doing an incredible job responding to the task at hand by providing resources, both material and personnel, in order to meet the challenges associated with this. I won't lie to you, a lot of us are nervous about the months ahead, not just for this hospital, but for the rest of the country. But we're staying optimistic. We're trusting in our training. We're trusting in each other. And we're trusting in the political institutions that have rallied around this cause.
Well, it's good to hear that you're staying optimistic. But given that until very recently, the president was playing down coronavirus at every point, do you think that his delayed reaction may have cost a lot of lives?
Well, it's very difficult to say. The nature of pandemics is that they spread remarkably fast. And it was hard for anyone, whether in the federal government or at the local level, and even in some international organizations, to recognize just how quickly and virulently this virus would spread. After all, this is a virus that, at least by and large, we think humanity has never seen before. So its behavior was largely unprecedented and unpredictable. I think to the extent that our governments are able, they have recently mobilized all the resources they have at their disposal to help us. I'm very, very satisfied with the response of the governor of New York State, Governor Cuomo, and I look forward to the continued efforts of the federal, state, and local governments to help us.
Dr. Chidamam Ilabachi, thank you very much for joining us.